Hello, everyone, and a very warm welcome to this SIEL conversation, which almost marked the beginning of the spring season for those who are based, of course, in the Northern Hemisphere. Hopefully also the beginning of a new season of hope. My name is Maria Laura Marceau, and I'm one of the two executive treasurers of the Society. Just a couple of points before handing over to Gabrielle Marceau, who is the moderator for this session and also a former president of SIEL, as she likes to say, with a bit of a French touch. It's great to have you with us, Gabrielle, so thank you very much for being here. And also let me express our gratitude to all our panelists for having accepted our invitation to discuss such a timely issue today. So we are all very much looking forward to hearing from you and learning from you as much as we can. So thank you very much. There is one last person I'd like to thank, and she is Franziska Sacker, the other treasurer of the Society, for her help in putting this panel together. So Fran, thank you very much. And now just a couple of housekeeping items and a few announcements. Now, as a matter of course, we're going to record this session. We will upload the video on our YouTube channel shortly after today. So please consider subscribing if you haven't already. If you have any ideas for future conversations, please do get in touch with me and with the Executive Vice Presidents, Marcus Wagner and Isabel Van Dam. We will be happy to hear from you. Now, there is a Q&A box for you to submit your questions to the panelists, also anonymously if you wish. Then next session is on special and differential treatment under the WTO and is scheduled for the 22nd of April. You should have received the registration link already, and more information as always will be available on our website. So that's all from me. Enjoy this conversation, and Gabrielle, you have the floor.
Thank you, Maria Laura. It's a pleasure to be back with SIEL, my first activity since I left 2 years ago. And happy birthday to Maria Laura. It's also her birthday today. Outstanding panel with us today, and could not be more topical. It was full, it's in the press all the time, and especially today. An interesting decision or suggestion by the president of the EU. So COVID pandemic has shown the importance of trade, open trade for all countries. And it's been repeated that trade will be instrumental for sustainable recovery, employment, and building back better. But at the moment, there's still a huge health crisis. And then comes the issue of how to handle this health crisis. And for this, we all know that developing and least developed countries are at disadvantage. There's a lack of resource to respond effectively and a lack of production capacity of those medicines. So today we'll talk about that, the role of trade, the role of intellectual property. We heard about the request for TRIPS waiver. And we also read that Tony Blair, Bill Gates, and many others have said vaccination and distribution of vaccination should not rely on market forces, should not be limited by intellectual property. So today we have three, as I mentioned, outstanding speakers, experts in this field. The way we'll proceed is that we'll have minimum two sets of interventions by each of them for 5 minutes each. I'll have 2-3 questions, and then they will again speak, each of them for 5 minutes, allowing each of them to comment on each other or add. It's been suggested that we start with Fatima, who founded and is a member of this think tank NGO Health Justice Initiative. I think it says it all. And as expert for many years, Fatima, what are the specific limitations and production capacity in terms of vaccination in the developing world? And what are the COVAX forecasts for developing countries? And if you have the time, otherwise we'll come after, what is the link with India, South Africa, TRIPS waiver request and the production of vaccination? Thank you very much, Fatima.
Thank you, Gabrielle, and it's really great to be on this panel with Brooke and with James. So I'm assuming you can hear me okay and that everything is fine in relation to the sound. So I just wanted to make a few introductory remarks because, I come from a country, South Africa, where we had to deal with similar issues that we're dealing and facing with now during the height of the 2000 HIV/AIDS crisis, where access to life-saving interventions was just basically very slow and was prevented for many people in my country, including many of my clients and my friends and my colleagues. So here we are again, 2021, we're in the middle of a global vaccine equity and access crisis. I think that a very pernicious defensive form of vaccine nationalism has actually taken over in the world, causing more death and illness. We've just seen some of the excess death data in South Africa, and we're already looking at about 150,000 excess deaths that have been reported, aside from the number of deaths attributable to COVID. So in my own country, healthcare workers are still relying on study or trial stock, which is the Johnson & Johnson, for their own vaccinations, and everyone else, which we estimating about 40 million people in our country have to be vaccinated. We are all still waiting for enough supplies of approved vaccines to actually come into our country as part of a national vaccination rollout. So our national vaccine rollout has not even commenced in March 2021, 1 year after the pandemic was declared. While other countries have already started vaccinating, in some cases over 50% of their population, in other parts of the world, a third of their population, in other parts, 20% of their population. So some of my friends and colleagues elsewhere in the world who are young, who are healthy, have received a vaccine or in line for receiving a vaccine in the next 2 months, while my own mother, for example, who's over 75 in South Africa, is still waiting for a vaccine. So we're facing, quite considerable excess deaths and sickness in our region, not just in South Africa, but also, in other parts of Africa, despite offers of global solidarity that was promised to us at the beginning of 2020. And so the net result of that is that Black and brown people in many parts of the global South, particularly Africa and Latin America, are now at the back of the supply queue. And so your question about COVAX and the advanced market commitments, which are linked to the bilateral supply deals that were secured towards the end of last year, as well as the now limited number of voluntary licenses. All three of those have actually not helped the access situation in the global South in any meaningful manner. They've prioritized selective interests, selective geographies, and selective trade relationships. And the forecast for all of the supplies and deliveries for each of those mechanisms, I think, tells that story more powerfully than I can, within the space of my 5 minutes. So what we've seen in relation to COVAX, advanced market commitments, and the voluntary licensing measures or mechanisms is that there's been hoarding. There's been overcommitments by some of these drug companies, commitments that they can't meet. In fact, yesterday, the EU chair said that there's been an overpromise and an under-delivery, particularly on the part of AstraZeneca. There hasn't been transparency. There's been ad hoc voluntary licenses that are limited, like I said earlier, and they're also secretive with very worrying market segmentation. And we witnessed that firsthand in relation to AstraZeneca's sub-licensing deal with the Serum Institute of India. So for COVAX to say that only 27% of people are likely within low-income countries to be able to access vaccines by the end of 2021, I think that tells us that the drip feed mechanism of drip feed supplied by pharmaceutical companies to the global South in the middle of a pandemic, 1 year into this pandemic, shows that actually the market is not working. The system is not working as it's meant to be. The market has actually, taken greater precedence over people's lives. And measures such as compulsory licensing, which is permitted through the flexibilities of the, residing in the Doha Declaration, permitted through TRIPS, as well as the TRIPS waiver request, which is also within the rules of the WTO. Both of those measures have been resisted, they've been blocked, and they've been opposed. We've seen that particularly in the last few weeks. The waiver, as you know, was led by South Africa and India. It now has the support of over 100 countries. It's been negotiated since October 2020. We're still negotiating a TRIPS waiver in the middle of a pandemic. And yet a handful of countries, the very countries that are already vaccinating their populations on quite a widespread basis, who have secured enough supplies, in some cases, more than 2-3 times than what they need, they are the countries that are blocking the waiver. So I think there's a certain irony, and I think there's also a certain anger that is now building in the Global South in relation to how these countries are responding to the TRIPS waiver requests in Geneva. And I can't stress enough, and we can talk about this in the Q&A, that the waiver is located within the rules of the system, and it's still being blocked. And I think that it's really time for text-based negotiations. We simply can't continue these negotiations. They've been talking about it, I think, at 8 or 9 different meetings now. We really need to move to the point of text-based negotiations and sort of have it out at that particular level so that the evidence can actually be brought to the TRIPS Council so that we can discuss this finally. So,
Thank you, Fatima. We'll go back to the TRIPS in the next set of comments, because this evidence that you mentioned will become interesting. Can I now ask Professor Baker from Northwestern University, and who's also honorary research fellow from KwaZulu-Natal, and also a senior policy analyst to Global Access Project, so another top expert. What policies in the global north facilitated and impeded innovation and equitable access to COVID health technologies, and in particular, the roles, positive and negative, of intellectual property? And of course, you're welcome to comment on what Fatima said, but I would just note that this morning in the press, I read, I'm from Canada, that Canada and Mexico did ask President Biden to help them access vaccines. So it's also a problem for maybe less stringent for rich countries, but nonetheless. Professor Baker.
Okay, thank you very much. And just to clarify, my university is Northeastern University in Boston, and the NGO I work with is Health Global Access Project. So thanks so much to Fatima for kicking us off and giving the perspective from really ground zero. And I just have to say, I have a sense of almost despair. This left arm has received one shot. I'm the same age as Fatima's father. And I have a Moderna shot on my left arm. I'm getting my second shot next Monday. And of course, there are many, many people, millions of people in the US who've also accessed, and we're going to basically hope to have most of the people in the country vaccinated by July 4th, according to the current initiative in the US. And it's frankly grotesquely unfair that this would be true in the US, and that Fatima's father might well wait for a year or more, and other countries might wait into 2023 or even 2024. So what are the policies in the global north, and particularly the US, that have and in corporate control of supply, price, and distribution that have resulted in the vaccine access inequality and crisis that we certainly see? Well, we know that there were some positive steps. There was massive investment in vaccine development, certainly before the pandemic hit, but most especially afterwards, well over $10 billion in investments. But it came with no strings attached. It basically left the control over the resulting vaccines that were developed within totally within the control of the companies because of their intellectual property rights, including patents and trade secrets. There's been, from the beginning, strident protection of intellectual property. Those statements were made from the very beginning, both by the industry itself and its association, and by its political supporters and even some academic supporters, basically saying, bravo to industry. It's been able to do this innovation solely because of intellectual property protections, and this, we need to make sure that that system prevails into the future. And if it doesn't, innovation will shut down, companies will no longer invest in pandemic response, and we'll all be left far behind. From the very beginning, the rich countries planned to hoard vaccines and other health technologies. Part of their funding commitments to research and development and initial manufacturing capacity were in fact tied to preferential advanced purchase agreements and options on the medicines. So they both invested in the discovery, but they most particularly also invested in having preferential access and disproportionate access to the supply. And of course, since we gave the power through intellectual property and normal commercial rules to the companies to decide both how much is supplied, what the price is, and who they can sell to, the companies were quite willing to sell to the countries that were willing to pay the highest prices. And just in terms of the expected profits and profiteering that's happening, we know that Moderna has estimated that its profits this year will be at least $18 billion, or its sales will be $18 billion. And Pfizer has estimates between 15 and $30 billion. So huge amounts of money to be made and basically left complete within the control of the companies. There was, from the beginning, as early as October, when South Africa and India first made their proposal to the TRIPS Council for a time-limited waiver of the essential intellectual property rights that cover COVID technologies. The US, European Union, Switzerland, Norway, France, Canada, Australia have all bound together to oppose the waiver and to prolong its discussion and consideration at the World Trade Organization, both within the TRIPS Council and the General Council. There's been very limited support, in fact, no support for the COVID-19 Technology Access Pool, which was set up almost 10 months ago, completely set up and asked for voluntary contributions of technology, and no biopharmaceutical company has put one iota of technology into that pool yet. And then we know that, let me just say one more thing about
I want all of us to talk about the waiver, but go ahead and then I'll ask.
I just want to also emphasize that the Access to COVID Tools Accelerator that COVAX is part of has a very limited expectation of the supply that will be provided to low and middle income countries, less than 20% of need by the end of this year. And the question is, well, what about the other 60%? So the current mechanism is not designed to deliver the quantities of vaccines that are needed for us to achieve global herd immunity.
Thank you very much. I want us to all, the three of you, to talk about the TRIPS waiver. But before Professor Bacchus, Jim, you have a long experience in national and trade issues. And like me, in a way, trade is said to be necessary for dealing with the pandemic. But at the same time, as you may have read this morning, for instance, we saw that Europe may reimpose further and additional export restrictions on vaccine, and they may even sort of waive intellectual property within European countries for this vaccine. So where is the solution? Is really trade to be used, and how? And then you have written about the TRIPS waiver that I want us to develop. Why don't you give us your views? But first, is really trade working?
Trade is not working nearly as much as it should. This issue of the health-related aspects of trade should be at the very top of the WTO agenda. And I was pleased to see that our new Director General has put it there. In such mundane matters as tariffs, there are extraordinarily high barriers at the borders to trade in essential medical goods. There are also unnecessary barriers to trade in medical services. A priority for the WTO should be eliminating these and doing so now to be culminated at the ministerial conference in Geneva. year in. Beyond that are all these issues relating to intellectual property. Let me say at the outset that as I have previously written in papers published worldwide, and as I've said on numerous Zoom platforms in recent months, I am appalled by vaccine nationalism. I believe it is unethical. I think it immoral. As an American, I think it's un-American. And also as a matter of self-interest, which motivates not only the United States, but I think every country, for the most part, it's a mistake because acting nationalistically through, for example, export restrictions is not really in our self-interest, either in terms of health or economic recovery. All that said, we come to the issue, I think now, given where we are, of what we think will work best to get everyone in the world vaccinated as soon as possible. And here, as I've said, I think the answers largely lie outside the WTO. As much as I was disappointed by pretty much all that was done by the developed countries in the past year, I'm encouraged by what is starting to be done now by many of the developed countries. Frankly, I don't think this is because of any pressure posed in the WTO by the suggested waiver. I think it's simply because we now have a decent human being as President of the United States. I was encouraged by the announcement by the so-called Quad last week that Australia, Japan, India, and the United States are going to work together to provide an additional 1 billion doses in the Asia Pacific region by the end of next year. Clearly, that's only a start. The last I looked, there are 130 countries that have had no vaccinations. In Latin America, I think 5% of the people have been vaccinated. As Fatima pointed out so vividly, in Africa, I think the number is 1%. So we're far from doing what we should be doing. We need more such initiatives. In terms of the request by Canada and Mexico, it's being reported in the United States today that President Biden is expected to announce tomorrow that we will be providing overflows doses to our two closest geographical neighbors, but much more should be done there. The United States has millions of doses, especially of AstraZeneca, stored that are not yet approved for use here, but are approved for use elsewhere with the qualifier of the current European stand down. And we should be looking at doing a lot more and a lot more quickly to vaccinate everyone, everywhere.
Thank you. So in that context, I'd like to go back to Fatima on the issue of the TRIPS waiver. And can you explain how the TRIPS waiver, setting aside the intellectual and conceptual debate, how the TRIPS waiver would help enhance production capacity of vaccine, and anything to say about supply chain? And I note in that context, the new WTO DG who said there should be a focus on this issue, enhancing production capacity. So can you please help us? How would the TRIPS waiver help deal with the pandemic and the vaccination needs, please? You're muted, Fatima.
Can you hear me now?
Yeah.
Okay, so I think the understanding behind the TRIPS waiver is that it's one part of a bigger piece of the puzzle in order to try and secure access for low income countries, particularly in the global south. So let's just focus on the TRIPS waiver. The idea behind the TRIPS waiver, and it was contained in the submission in July 2020 already from the South African government to the TRIPS Council, to indicate the difficulties that many countries in low income parts of the world would have if they each had to individually take compulsory licensing measures and use Article 31 of TRIPS, or use the Doha Declaration and the TRIPS flexibilities, which haven't really been successfully used in the past, even with HIV/AIDS. It's very difficult because of a number of geopolitical as well as trade pressures and factors. So the idea behind the TRIPS waiver is that it makes it easier and immediately opens basically the gates for the transfer of technology and for the transfer of vaccine know-how. It obviously requires the explicit cooperation of all the pharmaceutical companies, as well as the governments that have co-funded and co-developed some of these front-runner vaccines. Because remember, it's not, it wasn't just developed alone by a single individual pharmaceutical company. There's been a considerable amount of public funding. The latest estimates in the Lancet are about $10 billion that were invested in some of the front-runner vaccine companies. The second reason for the waiver request, to make it simpler and easier, particularly for countries with weaker legal systems or weaker trade systems or weaker IP systems, is that they wouldn't face in each of their domestic contexts and countries litigation by pharmaceutical companies trying to assert their intellectual property claims or rights in a pandemic. So you basically level the playing fields. And I think, what happened last week or in the last few weeks in relation to Russia, Hungary, Colombia, saying that they would try and invoke some compulsory measures. In fact, the EU even sort of, gave some of those indications, and the resistance and the pressure in response to that kind of move, I think signals why the waiver was considered politically necessary, but also necessary to be able to deal with the notion that the vaccine or diagnostic kits, because remember, it's not just a vaccine, it's also about our ability to test people for COVID in many parts of the global south, that should be treated as a public good.
Thank you very much. Brooke, you also know very much this world, but how would you suggest that we can scale up production of vaccine production, especially in emerging countries? How should we proceed, and will the waiver request help enhance production capacities?
So thanks very much, and I'd like to expand a little bit on what Fatima had to say about the waiver. One of the important aspects of the waiver is it covers trade secrets. With respect to vaccines, it's critically important with respect to complex manufacturing data, data itself, formulas, recipes, and frankly, the biological resources as well. The Article 31 is TRIPS deals with patents only. And we know that in this context, access to patents is simply not enough. Moderna has offered not to enforce its patents, but of course its entire technology platform needs to be made available. We clearly need deep technology transfer. And I think one of the huge values of the waiver is the threat of its use, its existence, its passage will bring pharmaceutical industry to the table in a quite different way. And instead of having completely industry-controlled supply decisions, which are producing artificially restricted supplies still, and just selecting, handfuls of contract manufacturers and having cozy cross big pharma supply agreements, we will be able to get capacity in other parts of the world and even build capacity. I think the best solution would be one where there's deep technology transfer, a facility that helps such transfer, massive government support, both from rich countries and development banks, to the expansion of that capacity. And then that capacity being available on a durable basis, not only to respond to the COVID-19 crisis and its variants, which are going to require multiple rounds of vaccination, which is another reason why it's so important that that supply be expanded. Because if supply is not expanded, the US is going to run to the front of the line again for the next variant. We're already seeing it. There are new variant vaccines being explored. Do you think the US is not going to try to get advanced purchases of those supplies as well? Of course they are. And we'll have the same cycle of preferential partial access in rich countries, the illusion of herd immunity in those countries, and the incubation of more variants in untreated populations around the world. And we will cycle through the COVID-19 crisis for years instead of just a couple years.
So a need
this goes,
for a longer term appreciation.
we need a longer term solution, and the waiver gives us the legal framework to really say you have to bring your entire technology to bear. You have to arrange for the transfer of that technology. There might be compensation for some of that. The transfer is not free. It has to be supported. There can be incentives provided. We already see the U.S. investing massively. It's put $269 million in the coffers of Merck to make Johnson & Johnson vaccine.
Yeah.
It's promising to invest very strongly in biological E-limited in India, again,
These
with
are
an undisclosed.
These are new form of collaborations, quite unique, no? This Merck Johnson.
They are, but they're still very industry controlled. They're within the cartel. And it's fine to repurpose existing capacity that some big pharma companies have. And it's fine to try to expand some capacity with preferred contract manufacturing companies. But that's different than building a distributed system of vaccine capacity in the global South, some in Africa, some in Latin America, some in Asia, not just in India, so that the world is prepared to have a supply system and an equitable distribution system. But I'd really like to emphasize the obligation of equitable distribution, because what we tend to think about IP monopolies only in terms of price. But what this pandemic has shown is it creates crisis of supply and it creates crisis of unequal distribution. We cannot let the decision of who's going to get the vaccine solely in the hands of the commercial entities in the rich countries that can run to the front of the line. We have to put obligations on companies that they have to supply equitably.
Thank you. And I think, as has been said many times, until the last Asian or African is vaccinated, there's a risk for every single American, as you said indirectly. Now, Jim, you mentioned this Friday deal by the so-called Quad, which is a unique sort of collaboration again, where Japan and US pay India to produce and Australia distribute. But I was speaking with Brooke and Fatima at the beginning, and they were saying that this production represents less than 10%, I think, of the needs, because we need about 12 billion and we have 3 billion capacity. Back to the TRIPS waiver. Don't you think that the TRIPS waiver would accelerate this capacity building? And what are your views about supply chain and these
well, first of all, as I believe I stressed at some length in my remarks, what happened with the Quad is a start. I believe, unless my memory is failing me, I went on to state that 130 countries have yet to give a single dose, and in Latin America we're at 5%, and in Africa 1%. Did I say that?
Yep.
Yeah.
I thought I did. Okay.
Yes, so, it's good. It's a step. It's a step into.
So I think my view is the same as theirs. Let me make an answer to your question. First of all, a few legal observations. Because we have in the WTO 165 countries that agreed on certain rules and are bound by them as a matter of international law. And what's being discussed in the WTO is the nature of those rules, their implications, and whether they should be waived in any way. And here, let me make some observations that I haven't heard in the public debate from any side. I was on the appellate body, as you know, Gabrielle, back during the long debate over HIV/AIDS drugs. And my view at the time was there is capacious authority under Articles 7 and 8 of the TRIPS agreement for proceeding with compulsory licensing whether or not a waiver was granted to permit it in the context of that particular health emergency. But of course, it wasn't my place to say so publicly, so I did not. And no one ever tried to do that in the absence of a waiver, so there was no dispute before us on the appeal in the appellate body. But I think that's still the case here. Although these developing countries are seeking a waiver, I would argue that there is defensible legal logic in saying they already have the authority to do what they wish to do under
They don't need a waiver.
Article 7 and 8 of the TRIPS agreement, and they don't need a waiver. That's some free advice for my friends in India and South Africa. I won't be sending a bill. It's also clear because of the HIV/AIDS waiver and the amendment in 2017 to the TRIPS that they have the legal authority to engage in compulsory licensing now. That is not what they're seeking. In reading the request for the waiver, what they have asked the other members of the WTO to do, and I'll just read it, is to waive protections in WTO rules for patents, copyrights, industrial designs, and undisclosed information, that's trade secrets, in relation to the, and I quote, prevention, containment, or treatment of COVID-19 until widespread vaccination is in place globally and the majority of the world's population has developed immunity. And now we get to your question. And it's one that hasn't been answered by India, South Africa, or other advocates of this waiver within the WTO. It's your question. What will the waiver do to enhance the capacity for production in these countries? And my view is, especially based on what I've heard today, is that this capacity for production largely does not exist in most of the developing world. Certainly it does in India, which will be a base for what the Quad is doing, and it does in some other developing countries, but it doesn't exist in anything approaching the majority of them. So if we're interested in getting doses now to the rest of the people in the world as quickly as possible, it seems to me that a sound argument has not been made that a waiver will accomplish that. Instead, what we need to do is do a whole lot more of what we seem to be starting to do.
Yeah.
With these Quad action, with the actions with respect to Mexico and Canada, and get going. Now, my concern is that there was a geopolitical undertone on the part of the Quad to the announcement last Friday, and that it was motivated in no small part by a desire not to allow China to look like it's a great altruist worldwide. Some of that same motivation is missing in other parts of the world, in Africa and in Latin America. And we should not be doing these things for geopolitical reasons. We should be doing these things, one, because it's the right thing to do, and two, because it's the right thing to do even in the self-interest of the developed countries that will be doing it. And the ardent advocacy that's being employed to try to secure a WTO waiver, which will not be secured in the near future, should instead be shifted to encourage the United States, the European Union, and others who are in a place to do so to accelerate their own production, start now sharing doses worldwide, and especially where they have stockpiles of doses they're not using, to get them out to the rest of the world. That's where the pressure should be placed right now to achieve what should be the global goal, which is leaving no one behind and making certain that all are as vaccinated as soon as possible. There
Thank
is
you.
absolutely no point in having another long debate a la the HIV/AIDS drugs debate in the WTO over this issue.
Thank you. And if you allow me, Jim, also rich countries should invest in building production capacities.
Well, that's the last point I wanted to make, because Brooke made a great observation on technology transfer. And he is absolutely right that we need to begin doing that, and it should be backed by capacity building and investment. But here's the legal point I would make. Since 1995, in other words, for 26 years, developed countries have been obligated under Article 66, paragraph 2 of the TRIPS agreement to provide incentives to their producers to engage in technology transfer to the 48 least developed countries in the world who have, what's the current gauge? $1,000 or less annually per capita, largely sub-Saharan African countries and island states. And despite what they may say, developed countries have not kept this commitment. They've offered a few meaningless reports saying they have not kept this commitment. To me, they're subject to dispute settlement on this issue, but what we need to do is not only comply with that obligation, but expand that obligation along the lines Brooke suggested.
Thank you. So I think now I will read out 3 of the questions we've received, and then I will go back to each of you, starting with Fatima. You answer the questions you want, and you can add comments. So one question refers to the TRIPS flexibility and suggests that the reason why governments don't approve the TRIPS flexibility is because of fear of retaliation. Another question addressed is, how do you evaluate, from a point of view of WTO compatibility, the EU export authorization schemes, the EU restrictions, in other terms, export restrictions? And one specific to Professor Baker, you mentioned this collaboration and the need to facilitate deep technology transfer apart from the role of government and pharmaceutical companies. So how do you see such new entity? And could you expand on why traditional companies' collaboration are not enough? And on this, I note something that surprised me last week, a proposal that in Africa, Coca-Cola, who has freezers throughout Africa or some part, could collaborate to the distribution, and UPS also to step in. So these sort of new collaborations, private, public, etc., could help, but a bit more, why do we need something new completely? So Fatima, please feel free to add on any of what we've heard. Thank you.
Thanks. I'll just deal with retaliation and manufacturing capacity. So the first is that in my country, even at the height of the HIV/AIDS crisis, even with a very progressive constitution, we have never issued a compulsory license on a pharmaceutical product in 100 years, because there is a deference to pharmaceutical powers and interests and to intellectual property claims. When we try to change our laws to permit parallel imports and the introduction of generic versions of life-saving treatments, we were sued by the pharmaceutical industry. Nelson Mandela and his government was sued in the first 4 years of our new democracy. It resulted in a withdrawal, and after that, our government has not been able to take any meaningful action against these companies. We were put on a trade watch list, and it created a trade war between the US and South Africa. And I think the very same arguments by the industry at that time were contained in a submission a few weeks ago by US Pharma that made its submission to the US Trade Office in terms of the countries and the institutions that should be held in check because they're asking for relaxation of patent claims in a pandemic, a claim that even the WHO DG and Dr. Fauci has basically begged and pleaded to these pharmaceutical companies to do, because we're really in the middle of a crisis. And I think, the public health experts have just signed a declaration in the last week. Over 850 legal and public health experts have said we need immunological equity. We may not be able to achieve substantive equality around the world because we're living in a world of great inequality, but at least the vaccine gives us the opportunity for immunological equity. Now, coming to manufacturing capacity and the untapped capacity that currently exists, which without a waiver, you won't be able to fully utilize, and that capacity can actually be utilized within the next 6 to 8 months. There are many reports indicating this. We have, for example, 2 companies in South Africa. One has not been selected for any kind of vaccine sharing or know-how. They were pre-selected by COVAX. They haven't received any licenses. Another company, Aspen, has only been asked to do fill and finish for one company, for Johnson & Johnson. So I think they, you know, as Brooke said, this capacity residing in Latin America, in Asia, in Africa. Once you open up the technology, once you say nobody's going to sue you, nobody's going to exert trade pressure, nobody's going to hold you, you know, in other forums accountable and punish you because you are taking those measures, you will see that capacity exists. Our US colleagues, you know, finally, I'd like to say on the mRNA platform and that kind of technology, our US colleagues and activists are arguing that with a little bit of investment from the Biden administration, you could actually scale up the mRNA technology within the matter of months. It's not a technology that is going to take years to be able to retrofit existing capacity. And lastly, when the EU had a supply crisis a few weeks ago, we found manufacturing capacities. Sanofi Novartis came into the picture. You know, when Australia, Mexico, and now many other countries are having a supply crisis, Merck has been brought into the picture with Johnson & Johnson. So frankly, I think it's just a really disingenuous argument to say that no manufacturing capacity exists. The burden is on us to prove it in order to achieve the waiver. If you feel that there's no manufacturing capacity, then the member states who are opposing the waiver should just grant it, because then you prove us right. You know, that's my final comment on that.
Very right. Thank you. Brooke?
So thanks for the third question. I'll address it first and then maybe respond to a couple of things that Jim said.
Let me interject. I did not say there was no manufacturing capacity. I said there was insufficient manufacturing capacity. And I think I mentioned both the capacity in India and South Africa.
So
go ahead, Brooke.
Okay, so you know, the question is, you know, what could help the technology transfer if there were freedom from the intellectual property restrictions and we really had a commitment to deep technology transfer? Well, we do know that the COVID-19 technology access pool set up by the WHO has been slow to start. There's lots of reason to criticism kind of the pace of its availability, but frankly, no companies have indicated any interest. It could play a role in acting as a, you know, as a way to pool the intellectual property resources, the knowledge, intellectual property rights, and make sure that they get distributed to qualified producers. We would also need, I think, really an entity of some sort, and you know, the WHO has had this kind of entity previously with respect to the flu vaccines, kind of a technology transfer facility that is, you know, an organization, an entity that really has deep technical capacity that can help the transfer of technology from one, you know, very knowledgeable company to a company that does not yet manufacture that product. It's not easy. It takes some time. It certainly takes some resources. And that brings me to the third piece of it. It does need resources too. It needs funding. It needs funding. And frankly, it may result in some instances in funding for capacity that may not be fully utilized every day of the year for the next 20 years. But should we have basically a reserve of capacity available in the world to respond to conditions like this, do we need a reserve of capacity, not just for vaccines, but for monoclonal antibodies, which the developing countries have almost no access to a lot of the new biological, medicines, right? Vaccines and biologics. You know, we need that capacity in the global south, and we need it free of intellectual property protections. One of the problems with the industry-controlled model is they continue to control ultimately the supply, and they also control price. So take Pfizer, for example. Pfizer has offered to sell a portion of its production, a very small portion, to some developing countries for $6.75 a dose. There are estimates that the mRNA could actually be produced for $2 or $3 a dose, but that's far less than the price they're currently charging on the open market, including on the open market that will affect many upper middle income countries. So we also suspect that expanded capacity will allow and freedom from intellectual property will allow some price lowering, which is critical to affordability and thus access in poor countries. And then again, I do want to emphasize that at present, the voluntary licensing mechanism set up and controlled within industry entirely by itself does not presently have any mechanism requiring equitable distribution by the licensed entities. They can still preferentially supply rich countries, which is what they do, and then upper middle income countries, which they'll do next, and then the poor countries will always be left at the end of the line. And I appreciate what Jim had to say about there being an emergency, but you can't use the emergency to say, well, the only thing we can do right now is address the emergency. We have to do these kind of industry-controlled voluntary exercises like the Quad, et cetera. Because then you continue.
I did not say that's all we should do, Scott.
No, okay. You did argue that that's what we should focus on, and we should give up on the waiver. Okay. So
I did argue that.
Right. So I'm saying, no, we don't need to give up on the waiver because we still need to somehow ensure that there is this transfer of capacity and building of capacity that's free of intellectual property and total industry control in the global South. And that's what the waiver would help us accomplish, is to build that capacity for the future. We can't rely on donations. Biden has already indicated that we're going to make sure not only we vaccinate everyone, but we have a reserve in case we need some supplemental vaccinations. And then he's going to give some non-preferred doses to Mexico and Canada. I mean, Jim, you did mention the fact that there's some geopolitical factors involved, but so far what I've heard from the Biden administration is a Quad deal that's going to deal with Southeast Asia, and AstraZeneca donations that are going to benefit our closest neighbors, Canada and Mexico. And still, what about where Fatima lives? What about the rest of the world where, again, making political decisions about who gets preferential access is just a gross violation of human rights.
Thank you. Allow me to add a question that came.
Ask me a question, but I want to respond.
Jim, you will respond.
Especially when I've been called disingenuous.
Just a second, Jim. I'll let you respond and add, because I have a new question and we've been given an additional 10 minutes. So we have 15 minutes altogether. So if I sum up what I've heard so far, the waiver will increase, of course, build capacity and will allow her to lower prices to some extent and reduce the power of pharmas. But there is something shocking with big pharma making so much profits. It's a bit like the IT giants during the COVID making so much profits when others have difficulties. The additional question before I ask Jim is the following. Do you think we would have had the current vaccines now available without the self-interested efforts of the pharma industry to develop these vaccines in a very short time? So Jim, please respond to Brooke. And if you want, respond to this question, and then I'll go back to Fatima if she wants to add something.
Well, let me encourage Brooke and Fatima to read a number of the articles I've written on this issue. This is a panel discussion, and I haven't dealt with all the 15 or 20 points that I might make. What I have said to Brooke's previous observations is that I agreed with them. And I certainly agree with him now that I'm given a chance to say so about what he said about being prepared for the future.
Yeah.
And have written at length on these issues, Professor Baker. Let me also say what I think is happening politically in the United States. While first saying that I would not have taken this political approach myself. Had I been elected president of the United States, I would have taken action from the very beginning. First of all, in explaining to the American people, it was not actually in their interest to proceed according to vaccine or economic nationalism, explain to them why, and then I would have gone on from there. But what we've had in the United States until recently was a Trump administration, which I have opposed ardently and endlessly, and which I disagreed with everything they did related to this issue. And I would want people from other countries to know that there are Americans who opposed what he did. Indeed, 7 million more of us voted against him that voted for him in the recent election, despite what they say. Now, what is Biden doing now? Again, he's not doing what I would do or what I would advise him to do, but I think what he's doing is this. He first tried to get himself in a position where he could say, as he recently did to the American people, we're going to vaccinate all of you, and we're going to be able to do it by this time. And he's talking with some qualifiers in terms of July the 4th. Now that he's reassured the American people of that, he is turning to what he should have turned to right after he was inaugurated, and that is the rest of the world. And Brooke's right. We heard last Friday about what they're going to do in Indo-Pacific. We're hearing now of what they're going to do in Canada and Mexico. If Professor Baker waits another 2 or 3 weeks, I think you'll hear from some other initiatives. I hope they will be in Latin America and Africa to start, and I hope that they will be multilateral initiatives that will include other developing countries as well, just as happened with the Quad. Again, let me tell Fatima, I share your passion on this issue. I appreciate all you're doing for the developing countries of the world. I would submit that I've done as much or more in my life, probably because I'm older. But I think you're wasting your time on the waiver. If you feel as ardently as you do, seem to do, take my legal advice. Stop fighting for a waiver and go ahead and do it. Let someone challenge you in the WTO. Explain in defense that you're acting under Article 7 and Article 8. I think a reconstituted appellate body would agree with you. I may not be right about this, but the last time I looked, either Peter Van den Bosch or I had judged more international trade disputes than anyone else in the world. So it's probably an educated guess. I know how we would have ruled 20 years ago. And I think it's highly unlikely that a WTO appellate body is going to tell developing countries they can't give medicines to people who urgently need them. And I'm sorry if you think I'm disingenuous, but I'm being as straightforward as I can, and that is always my way.
Thank you. No, that's wonderful. Fatima, you may want to respond. And another question came, how come the countries like yours, South Africa, India, have not issued a compulsory licensing to enable sort of them to maximize production of these vaccines? You said that it was not used for AIDS, but why not? And why don't you tell your people to go for it? Copy the medicines, forget patent, etc., as suggested by Jim.
If you can hear me.
Yes.
So that's one of our key demands. I mean, the one thing that is shameful about the current administration is that while, unlike HIV/AIDS, it now believes in the science and the evidence around COVID and is actually responding, you know, with a proper evidence-based kind of basis, it's still not willing to take on pharmaceutical power. It's honoring non-disclosure agreements. It's set up indemnity schemes because these companies have asked for it. It's not disclosing the pricing to Parliament. It's not disclosing the, you know, the pricing to even the opposition parties or to civil society.
Pardon me, who are you talking about?
The South African government.
Which government?
The current South African government.
Okay, thank you.
So one of the key demands, which, you know, basically was articulated in March 2020 already, was that the South African government should take compulsory measures, but it's refusing. So there is a certain set of double standards around why you're refusing to take on pharmaceutical power, one, in relation to your bilateral negotiations, but two, also in relation of only pursuing the waiver and not threatening compulsory measures against pharmaceutical companies. And so what we have said in South Africa as civil society is that we'll support the waiver, but we also expect our government to take much more forceful action, particularly as there's been so much opposition to the waiver. So we are definitely not the apologists for the South African government. We believe that it we can do a lot more. We believe that it's definitely giving a lot of deference and a lot of power to pharmaceutical companies, particularly because when we paused the AstraZeneca rollout, it was a pharmaceutical company that decided to step forward and give study stock so that healthcare workers could start getting vaccinated. So there's a really lopsided set of power relationships happening in South Africa. And so this is why, you know, when Brooke talks about the political considerations and decisions, what happened today? Sinovac has offered South Africa 5 million dosages of its vaccine. It has now submitted its dossier to the regulatory authority. Up until 3 weeks ago, Sputnik had not submitted its dossier. It has now. So there are now multiple options for the South African government in terms of who does it sign a final deal with. But in all of those deals, in all of those bilaterals, these are the legal cases we're fighting around greater transparency. So, you know, and I've explained the history of why this government, the post-apartheid government has been reluctant to take on pharmaceutical power based on what happened in 1999 and the early 2000s. Just in terms of
how would the waiver change that?
So I think I've explained that before, but I'd like to just give you 2 examples of what we're dealing with in terms of a global supply crisis, because there definitely isn't an uninterrupted supply, set of factors, nor is there timely supplies. I mean, what's interesting in terms of the geopolitics is that Italy takes measures to stop the exports of certain vaccine supplies to Australia. Canada, which is actually had signed a lot of advanced market commitments where they were accused of having 3 or 4 times more than they needed, also drawing from COVAX, also now faces a supply crisis and asking the US to step in. So clearly it's not working, and we need whatever measures we can, whatever steps we can take. It may include the waiver, it may include compulsory measures, it may include voluntary licensing. I mean, we saw that at the height of the HIV/AIDS crisis, when compulsory measures were threatened, just merely threatened, that is when drug companies came to the table and actually issued multiple voluntary licenses for the global south.
Thank you. And Fatima, you will agree with me that whether it's Chinese vaccine or Russian vaccines, the issue of price raised by Brooke is still there. Because I remember reading that I think Hungary got some vaccines from Russia at a price the highest in Europe.
Yeah,
Brooke, yes,
definitely.
Lori,
Pricing. No, just quickly, pricing transparency is not just a key issue in the bilaterals with any of these vaccine companies who have regulatory approval. And that's important because in South Africa, we only have limited authorization. It's called a Section 21 for Pfizer and now for AstraZeneca, and that's it. Nothing else has been approved, right? Okay. But there's also no price transparency in COVAX. We know there's a tiered pricing model. So the pricing transparency, I think, cuts across all institutions and across all bilaterals and all companies.
Okay, Brooke, now Jim told Fatima to go ahead, copy and sort of take care of sick people. Interesting. What do you do with export restrictions? What do you do if a country refuses to give you things and it's illegal?
Well, I'd say there's 2 real problems. And you know, I think the waiver, it really is important that it's a global proposal, and it would work best if every country then actually operationalized it nationally. The mRNA vaccines have 100 different components. They're manufactured in more than a dozen countries and are patent protected. South Africa does not have the knowledge internally. If it eliminated all IP, it would not be able to make an mRNA vaccine because it has to source from places where those are protected by trade secret and by patents someplace else. So the idea that countries can act on their own in an uncoordinated way to make vaccines is simply a fiction, I think, at this point. I regret that it can't work. Maybe in India, there may be some countries that have enough internal manufacturing and scientific expertise to do this, but most countries in the global south do not have that capacity. And if we want to really build that capacity and allow it to access the supplies needed, we need not only to have the something like the waiver adopted globally so that there's really a global sharing of technology, but we have to end the export restrictions that first started with the personal protective equipment and now extend, even again in the US. The US use of the Defense Production Act has resulted in the prohibition of export of some key technologies that are needed in vaccine manufacture. The Serum Institute of India has said, we don't have some of the bags that we put inside of bioreactors, and we don't have some of the other equipment we need because of the new restrictions on prioritized access to serve U.S. manufacturing interests. So these are it's why the global framework is so important, and having a global solution that's based on solidarity, that's not based on commercial priorities, that's not based on nationalism, that's not based on preserving intellectual property empires. And the waiver is a step in that direction. I wish it were true that you could just say to a country just like South Africa, there's things they can and should do. But if they eliminated all IP tomorrow, okay, by an emergency declaration, they could not manufacture an mRNA vaccine, even though it's the easiest one to manufacture to bring up to scale, without access to the technology from the companies, forced by other governments elsewhere.
So collaboration is a necessity, and I think we'll end on this unless you have something urgent to add. And we should remember that, this is really where I think we see we're all equal, because it's unfair that the distribution takes place on perfectly as we've seen, but until we're all vaccinated or immune or protected, each of us, rich and poor, we are threatened. And this is for the first time a challenge in international law, in trade law, in IP law, but also morality, as mentioned.
Gabrielle,
so I thank you very much.
There's one legal question we have not answered that's been posed by several of the questioners, and that is about clarification of the legality of export restrictions.
Yes.
Yeah, I'm very much opposed to all of these export restrictions, and have said so repeatedly. This does not mean, this does not mean that currently under WTO law they are illegal. Generally, export restrictions are illegal under Article 11 of the GATT. However, if they are if the products are in short supply, then restrictions are permitted. We need clarification for a short period. But with no definition of how long that period is. And so we're in need of clarification by the members of the WTO on this issue. And that should very much be part of what I mentioned at the very outset, what the WTO should be doing affirmatively to create freer trade in medical goods and services.
Thank you, Jim, for adding on this export restriction. And as noted by Brooke at the very beginning, it is interesting that the EU is considering waiving IP within EU countries and still resisting international waiver, but it is an emergency allegation by the EU president, a bit similar, I suppose, to the one from South Africa and India. And on this, I thank you all. I think it was very interesting. More questions are coming up. Thank you to SIEL and thank you to all the speakers. Outstanding panel, really. Thank you very much. Goodbye. Bye, Jim.